All right, welcome once again. I'm Dr. Dischiavo. I will be your lecture instructor, and we are beginning with chapter 1 in your book. You should have your lecture notes, or you can print them offline. Either way is fine. And this chapter is very, very basic introductory stuff. Okay, so we go from basically chapter 1, one of the easiest, into chapter 2, one of the most difficult, because we go into basic chemistry. Now, for chapter 2, I asked you to watch that at home, right? Please understand, if you've taken chemistry, I'm taking chemistry and paring it down for you. I'm not going in depth. I try to give you enough so you understand the basics to get through what we need to get through without killing you with chemistry. So if you look at it and go, well, there's so much more to that, well, absolutely. But I'm trying to keep it a little simpler for you. Now, chapter 1 is pretty fun because this helps us to understand the basics so we can get around the body, so we can define it and explore it and understand what it does. So what does anatomy mean? Does anybody know? It is the study of the what of the body. Begins with an S.
Structure.
Structure, okay? Structure of the body. What is physiology?
How does the structure work?
How it functions. So physiology and function begin with sound for me. That's how I started to memorize things. When you start studying and memorizing these things, guys, you're going to be studying a huge amount of material. The quicker you can make correlations, the easier things will be to remember and understand. You do understand you're going to be studying at least an hour a day in this class. And if you do that slow and steady, who wins the race? Right? The turtle. If you're the hare and you wait until the night before, guess what you're going to be doing? Mom, what did I do? Right? Don't wait until the last minute. If you take 1 hour a day and try to memorize this material, it'll come much easier to you. You should also be memorizing this material to the point where if you look at the PowerPoint slide and you cover it, you can almost recite what's on that PowerPoint slide. Do you know when you really know something? Good morning.
Good morning.
Do you know when you really know something?
You can explain it to someone.
When you can teach it. Imagine that you have an appointment with me next week and you're going to teach me chapter 1. I didn't learn stuff this well until I taught it. So pretend that you're going to go teach it to other people and then you know it. Okay? All right. So anatomy and physiology. So we're going to look at the structure and the function of the body. Pretty much with lecture, we'll be talking about all these things and then in lab we apply them. All right? Sometimes I'll run some music as we're going, okay? So the syllabus, I said, and Blackboard will completely go over in lab. I gave you some basics, so don't worry about it. We'll cover the rest. Some suggestions on studying. I have some great videos that are in Blackboard that you can watch that suggest how to study. But I'm telling you, it's very basic. Do you think there's any tricks to memorizing this? Well, there's little tricks, but I mean overall, do you think there's any tricks? No, I would not be here if I had the tricks. Guess what I would be? In Jamaica, on a beach, making $1 million, right? This is just kind of grunt work that you need to sit down and do. So for example, I say an hour a day. If we have 20 pages of lecture notes, spread those lecture notes out over 7 days, study 1 hour a day. Okay, same thing with lab. Really try to absorb it slowly. So lab and lecture book. A medical dictionary might be good in the long run for you, okay, but I don't think that's really necessary at this point. Guess what your best source of support is? This girl right here, right? I am here for you. I'm not scary, I promise. Come to my office hours if you're not understanding something. I'm also, in a week or two, gonna hold open lab hours, so if you are scared of me, you can tell your friends your questions and they can come ask me in lab. Just kidding, okay? All right, so I'll let you know when those open lab hours are going to be. I think I'm gonna do Thursdays, maybe 11 to 12:30 or so. I said noon, but I think it'll have to be 11, all right? Bring your questions and come on in. I'm also extremely responsive to emails. So if you're like, wow, I really don't understand that, shoot me an email and within 24 hours at least, I'll get back to you, okay? All right, so understand, don't just memorize, repeat, repeat, repeat in different ways. The great thing about these lecture videos online is you can rewatch them. You can watch them and like while you're doing something else and try to picture in your head. They're a really great tool. The other great thing about the lecture videos that I found is people will pause them. I don't understand that. They'll look something up on YouTube or whatever. Oh, okay, that makes more sense. And they come back to it. Write page numbers of cross references in your lab book. This was something that I always did wrong when I was doing lab. If you're doing something in your lab book and you're like, I don't get that, write down the page number in your Myriad, the big book that you found it, because inevitably you'll want to go back and read it. And then word roots. If you start to learn some of those, you'll be able to put things together, okay? So basic tips, they may sound familiar for most of you, but I like to throw them in there for you. Okay, so we're basically gonna talk about terminology and how we speak this language of anatomy, and why do we want to have a common terminology? Why do we want to have a common terminology? So we are all, what? Yeah, on the same page. I don't think I'm breaking HIPAA with this, but forgive me if I am. My father-in-law was very, very sick about 10 days ago. So thank God he's okay. But do I want the doctor and the nurse assistant to know what's going on? Absolutely. So he had uncontrolled AFib with an associated hypertensive state. Should they know what that means? Absolutely. We all need to be on the same page, so we need to have the same words to speak the same language. Okay? So we're going to start with some very, very basic anatomical terms, directional terms, basic concepts. Who has studied basic cells at this point? Have you had a basic introduction to cells? Even just from general bio, okay? Do you think in this class it's important to study cells?
Sure.
Absolutely. What do you think the basis of pathology is? Where do things start to go wrong in our bodies? In the cell. In the cell. So we do go over the basics. Is it ad nauseum? For those of you who don't know what that means, does that make you want to puke? Do we go into it that much? No. But I do expect you to have a basic working knowledge of this cell. Because guess where cells are in the body?
Everywhere.
Yeah, everywhere. We're made up of cells. Those cells combine together to form tissues, those form organs, those form our organ systems. So we do go over the basics of cells, and that's why. And that's what that hierarchy means. Starting from a cell all the way up to the organism itself and how that all interacts together. Okay, so we're going to talk about the structure and the function together. Some people study them separately, anatomy and physiology. I think it's tough. How can you know the function of the heart without knowing the structure of the heart, right? So we combine it together. Sometimes it's separated at higher levels because they study it so more in depth. So you'll have your general introduction, then you have a breakout of the separate anatomy and physiologies. So different topics. So gross is not disgusting. Gross means what? Overall or big. Okay, so we do a lot of gross anatomy studies. We do a cat dissection, we do a sheep brain, we have nice models in there that we use to look at those big structures. Regional, we don't really do regional in here. Who do you think might do regional anatomy? Think about medical doctors. What type of medical doctor does regional? Yeah, surgeons do, right? Like a thoracic surgeon works in the thorax and knows that thorax really well, right? Okay, we don't really do that. That's more like a medical school level. So we do systemic, and that's where we study all of the different organ systems. We'll do cardiovascular, we'll do respiratory, and it's nice because then you link all of those parts together and how they function as a whole. Surface anatomy is going to be structures on the skin. Don't really do much of that. Developmental is embryology, okay? And I give you a little bit of embryology at the end of every chapter and where that organ system comes from in the embryo. We also do embryological development at the end of AP2, okay, which is the end of the spring semester. Microscopic is everybody's favorite, right? Okay, I walk through the microscope so slowly. How many people have experience with microscopes? Okay, it's about half and half. So if you have experience, you're gonna be like, oh God, this is so slow. But I felt so lost when I did histology that I really want to make sure that you understand it. So if you're in my lab, you'll see we go really slowly through microscopic anatomy. Okay. So cytology is the study of cells. Histology is the study of tissues. Tissues, quite simply, are groupings of cells that function together. We're going to go through all those definitions in just a minute. Okay. Is it all making sense so far? Now, as I go along, if anything's not making sense, raise your hand, please. Okay. I think I forgot to mention one other thing. This is me and Dr. Dischiavo coming out. I have one big rule in my lectures, other than not cheating. Does anybody know what my big rule in lecture is? No phones. If you are here, you are focused. If not, you don't have to come. Now, am I a total ogre? Sometimes, but usually not. Okay, come on in, have a seat. If you have an emergency and you must be on your phone, right there, okay, just go like this, right, and step out, okay? So if you need your phone, step out. I don't mind. If you have to use the restroom, you can just go. If you need to leave, just go. You don't need my permission, okay? So that's the only thing I really get mean about. I just think it's rude, all right? You don't need to come. If you want to be on your phone, you can be on your phone at home. All right? Or wherever you want to be on your phone, as long as it's not in the car, right? Okay, so anyway, back to this. So topics of physiology is going to name this pretty basic. Cardiovascular would be heart and blood vessels. Neuro would be neurology, which I teach at UC, okay? And the functioning of those. So these are best put together. The structure and this function, such as the air pockets of the lungs and how those are kept open. So we'll study the structure of the lungs, all the anatomical structures and why they're there and how those air pockets stay open, etc. Okay? The bladder is just basically a bag that's very stretchy, right? But we need to know those structures before we can put together the functions. Okay. So those levels of organization, and we're going to go through all of these. So basically, the first 1, 2, 3, 4 to 5 weeks, we're going to have to go through chemistry, cellular structure, this general introduction, so we have a working knowledge of how to map out the body, and then tissues. And then we move into organ systems. So these first 4 to 5 weeks, really, if you have any questions at all, don't hesitate, because it's a little, I think because it's not a gross or big picture, people sometimes get confused. So don't hesitate to ask any questions. I can tell people are hesitating already. Don't. Because if you're thinking it, I guarantee you somebody else is thinking it. Okay? So there are no dumb questions. Feel free to ask them. Okay? So, and I generally do 20 to 25 minutes of lecture. We do a music break for 2 minutes and then we rejoin. I don't do big breaks, I do quick small breaks because I can already feel all of you need a little more caffeine, which is fine. I need more caffeine too. All right, so that's how I run my class. So when you have a break, it's just quick in and out, refresh yourself, and then we'll come back and restart. Okay, so levels of structural organization. Chemical to cellular, cellular to tissue. Tissue will be a common grouping of cells with a similar function. And I'm zipping through this because I think it all makes sense, right? When you have 2 or more tissues, you now have an organ. When you have 2 or more organs that function similarly, you have an system or an organ system. And then you are the organism. And this picture, I think it's been updated in your book. Oh, wait. This is the picture, all right, of how those all go together. But this will just make all sense as you start to learn these things. And at this point, I'd like to do a quick 2-minute break. So let's just do some of these because some may not sound familiar. So out of what we just spoke about when we talked about chemical, cellular, tissues, organs, organ systems. Real easy one. What would cardiovascular be?
Heart.
Heart. And vessels. All right. Arteries and veins. Some people include lymphatics with that. Lungs.
Breathing.
Breathing. So out of the list of what we just said, that would be chemical, cellular, organ, organ system, organism. What do you think? 2 or more tissues create an organ. You see where I'm going with this? Okay. Bicarbonate, any guesses with that? That would be lumped into chemical, cellular, organ, organ system, organism. Chemical, right? You don't know what those are yet. Maybe some of you do. How about me?
You're a organ system.
Organism. Okay, so all of these which is really fascinating. I didn't really like the thought of us existing and functioning automatically didn't really hit me until I had kids. Right? And watching, I got one of those weekly announcements that showed you this is what your baby looks like, fascinated me. And the fact that all of this happens without you thinking about anything is fascinating to me. It's crazy. Okay, so organism. And then I showed you that picture previously, if that helps you. Let's just do a couple of these. So maintaining life, okay? So maintaining life. One of the big things that we have to do as an organism is to maintain our boundaries. How many bacteria, viruses, and fungi are we surrounded by?
Microbes are everywhere.
They're everywhere, right? Why is it that we don't constantly get sick?
Protective. We have protective barriers.
Yeah, these protective barriers. And guess what one of the biggest ones is?
Your skin.
Your skin. This is why if people have a huge burn, they're way more prone to getting infections, A. And does anybody know what the other thing is that happens with big burns? Full thickness burns. Anybody doing any work with patients now? Oh, all right. Full thickness burns means it goes right down to the fascial connective tissue in your muscles, so you can actually see that with a full thickness burn. Guess what they're really prone to losing? Not alcohol.
The
Right?
the water.
Water.
Level.
Right? So your skin is a fantastic barrier for not allowing things to get in or out that shouldn't. Guess what another huge barrier is to infections?
The immune system.
The immune system? Absolutely. I was thinking of like Surface. I just used it Yeah, your mucous membranes. You ingest tons of microbes. And along the long tube of your GI tract, you have a ton of white blood cells that are just waiting to kill off those infectious agents. There's also a very firm cellular barrier along your GI tract that's really selective. I always think of these guys as being like the bouncers at the nightclub. You're in, you're out, you're in, you're out, right? They're very selective, these cells along the GI tract. Okay, so movement is important. That's pretty obvious, right? Is it as obvious as it seems though? I'm moving through space, but what else is moving on me right now?
Bacterial.
Oh, bacteria. I'm thinking muscular wise. What else is moving on me right now? Even though I'm completely still. Your heart? Absolutely. Your blood vessels are surrounded by muscle. They're constantly changing shape to accommodate how much pressure of blood needs to go to your brain. I ate breakfast, so guess what else is moving? My GI tract is pushing that bread and peanut butter down so I can absorb it and churn it up. My eyes are moving, the pupils are moving, my heart, my blood vessels, my GI tract. Muscle is a huge part. The other thing that's important with muscle, which we'll talk about when we get to skeletal muscle, is heat. The movement of the skeleton and the skeletal muscles, I should say, are very important for maintaining warmth for us, especially if it's cooled out. Okay? So, maintaining boundaries would match with which on the list over here? Maintaining boundaries. Which does it match with? Chemical reactions that build up or break down. You know, let's go through all of them first. Let's go through all of them first. Okay, responsiveness. Why do we need to be responsive in our environment? It's kind of a broad-reaching question, isn't it?
Avoid danger.
Yeah, that's a big one, to avoid danger. So our body has a series of receptors throughout it that sense danger and have an automatic response. All right, so responsiveness. We need to be able to respond to our environment to either get away from danger and or interact with our environment, okay? Digestion. So the primary job of digestion is to break down nutrients so we can absorb them, and water. Metabolism. In general, what does metabolism mean? My chemistry people have had chemistry. What's the basic gist in one sentence of metabolism?
Energy.
Energy. We're going to either build up or break down structures according to what our body needs. Our body is dynamic 24/7, all year long. Our body is dynamic. If we go to sleep, it doesn't mean that our cells are stopping. They're still regenerating, they're still living, they're still functioning, okay? So, metabolism is those processes of either building structures up, such as taking protein and building up your muscular structure, or breaking things down, such as bread, so we can get the glucose from bread, so we can put it into our cells for energy. And that's happening all the time. We'll get way more into that in the future. Reproduction. Check. You understand what that is, right? Necessary for the perpetuation of our species, and we go over that at the end of A&P 2. Good morning again. All right? So this all makes sense, right? So now we can go back, right? Maintaining boundaries. Which one would you pick over here? Chemical reactions, skeletal, internal, external muscles, selectively permeable, ingestion, absorption, secretion, eggs and sperm. I think we got that one, right? Check that right off with reproduction. Can be sensed or automatic. What is maintaining boundaries best? Selectively permeable, right? Because you don't want to let everything in, you don't want to let everything out, you want to be the bouncer at the club, right? Making sure that you have the appropriate substances coming in and out. Fabulous. Movement. What does that pair with?
Can be skeletal.
Excuse me. Skeletal, internal, and external muscles. The three major groupings, just to lay the foundation, are skeletal, cardiac, smooth. Smooth muscles are found anywhere where we have a tubular organ. Blood vessels, uterus, GI, for example, and other places as well. All right, good. How about responsiveness? Yes.
Senses.
Sensed or automatic? Absolutely. So I'm watching all of you, trying to make sure that you're paying attention and understanding, because I get a good feel from people's eyes if they're not understanding things, right? But while that's all happening, I'm digesting my food, my heartbeat is going, everything is just going on its own. It's unbelievable. So we have a controlled part of the nervous system, and then we have an autonomic, which is automatic, which controls all those other processes. It's fascinating. Digestion. Which would you pick?
Includes ingestion, absorption.
Ingestion, absorption, and excretion. Excellent. Metabolism. It's a little tougher.
Chemical reactions.
Yes, the first one, right? Building up or breaking down. Good. Reproduction we got. Okay, so those are general functions that our body's always performing, right? That need to be maintained. So what we really need, right, for just survival, this isn't talking about like mental health, this is just the very basics to keep our bodies alive. So obviously nutrients, okay? We have macronutrients, we have micronutrients. I got it this morning and I had toast and peanut butter, but I also had my vitamins. So out of those, which is the macronutrient, which is the micronutrient?
Peanut butter and bread's the macro.
Yep, macro just means bigger. It's the bulk of the food that we eat. That's important because it gives us carbs for energy. We're gonna completely go over this in metabolism in its own separate chapter. Okay, so carbs are for energy. Fat is the second choice for energy. It also helps with hormones. It helps with insulating the body. It does a ton of stuff. You'll see in next chapter. And then proteins help to build the bulk of the body and the structures of the body. Okay, so carbs, lipids, proteins are our macronutrients from our bulky food stuff. Our micronutrients are vitamins and minerals. Those are also just as important for different ways, and I go through a very general list in the next lecture, or the one after, the next 2 weeks I do it. Oxygen. Okay, we know oxygen is important. Why do we know oxygen is important?
For breathing.
For breathing.
Chemical reactions.
There we go. Okay, you're jumping ahead. That's great. Chemical reactions. Okay, you need oxygen and glucose. And glucose is a what? A carb, but for layman's terms, glucose is a what? Sugar. You need glucose and oxygen to get into you, go into your bloodstream, go to all the cells of your body. When they go into the cells of your body, guess what those two things make very efficiently? Energy. Fat Krebs cycle, citric acid cycle, has anybody studied that yet? Right? So you need those two for that to function. Can you get energy without glucose and oxygen? Absolutely. It's just the most efficient way. I remember when I was, when my baby, my little one who's now 8, was 6 months old, he did not sleep for 2 years. Didn't sleep for 2 years. I was beside myself. And I used to literally eat a power bar and rock him while I was giving him his bottle and think, okay, some kind of, getting the oxygen, getting the glucose, got to get energy, right? Just trying to just infuse my cells with whatever I could to stay awake. It's not fun, believe me. Anyway, so oxygen and glucose you need for that energy. Water, right? It's on a commercial. I don't remember what commercial it is, that we're about 70% water. I think it's one of those energy drinks. Water is super important. Some people actually lump it into those nutrients. Some people keep it separate. It provides the bulk of the solution that is our body. in the bloodstream, interstitially, we'll get into that, in the cells, out of the cells. Water is the bulk or the solvent of the solutions of the body. It's super important. It cushions joints as well. It allows substances to move from place to place. It's super important. Okay, so make sure you hydrate. Appropriate temperature and atmospheric pressure. It's amazing to me what small of a span we can survive in, right? If our atmospheric pressure changed a whole bunch or our temperature changed a whole bunch, we couldn't survive. You know, we're kind of delicate little creatures, believe it or not. It's amazing, okay? So, just you need to know that in general, I would never ask you numbers as far as temperatures, and later on we'll get into that. Okay, so your body is constantly responding to things in the environment and resetting itself. If you're too hot, you'll sweat. If you're too cold, you'll shiver, you know, and you'll respond to that. If you have an intake of glucose, you'll release insulin, right? Your body's constantly changing and responding. And why does it do that? What is it trying to maintain? A balance, right? If you ingest way too much glucose, I actually had a patient years ago call me. I'm a chiropractor. I crack necks, right? Dr. D, she goes, I can't see. My first thought was, how'd you dial? But anyway, yeah, I can't see. Maybe that's why she called me. Maybe she just like voice, call Dr. Dischiavo. I bet that's what it was, now that I think about it. I can't see. I go, you can't see? She goes, yeah. I go, hang up the phone and call 911. Okay, because I'm thinking she had a stroke, whatever. Do you know what normal blood sugar level should be?
Like 80 to 120.
80 to 120. Hers was 700. 700. She had been ingesting upwards of 10 cans of Coca-Cola a day.
Ooh.
Can you maintain a homeostatic balance with that? No, right? She was way out. Thank God they stabilized her, stopped her on the soda, and she went back to a normal glucose level. And she luckily regained her sight. So we have these delicate little bodies that we need to keep balanced. So we respond and we try to rebalance, and we respond and we rebalance. She was able to keep a balance for a while, but then eventually probably her pancreas was like, I'm done, right? Done with you, and stopped responding, okay? So we try to maintain the stability and equilibrium. In order to do that, our nervous system is a huge part of this. Throughout your entire body, you have receptors that bring information into your brain. We have visual, we have sensory, we have balance, right? Don't forget that the whole time I'm moving around up here, I have to keep my balance. There's receptors that do that. And as that's happening, my brain's putting it all together, right? So the receptors bring the information in. The control center is your brain. And then what's the response or the effector in general? It begins with an M. It's a very basic word. So you're going to sense, your body puts it together, and then you have a what response? Motor response, right? Where you're going to constantly be controlling the muscles of the body as a response to whatever's happening in the environment, right? And your nervous system's doing this how many times a day?
All day.
Millions, I'm guessing. I don't know for sure, right? But it's got to be hundreds of thousands, right? Now, when your body responds, so I brought a banana for a snack, right? I voluntarily eat that banana, and then my digestive system takes over from there. It brings the banana in, it breaks it down, it gets glucose from the banana, among other things. That goes into my bloodstream. My bloodstream rises with glucose, and what do I release from my pancreas?
Insulin.
Insulin. Insulin takes glucose and puts it into our cells for energy, right? So that's a negative feedback system, where we have a spike of something, our body responds to turn it off, per se. Okay, is it really turning it off? No, but it's responding to it. As opposed to a positive feedback system where you perpetuate that physiological function. I don't like negative and positive feedback because guess what happens? So negative turns off something, right? What eventually happens with the positive? It gets turned off, okay? So I don't want you to lose your mind over this. Negative is the immediate response, positive is the immediate response, but they eventually both stop. A positive feedback system is clotting. You cut your arm, you're going to perpetuate that clotting, but then what happens? It ends up stopping. So don't let that blow your mind, okay? The only examples that I give you of I do want you to know it, know the basics of it, but the only positive feedbacks I give you examples are clotting and contractions, okay? So positive feedback starts and continues until that function is complete. Negative will stop in response to like the spike of glucose that I spoke about. Okay? And here's pictures of that. So clotting. And then insulin. This gives you shivering and insulin response, I believe. Wait, no, this is just a temperature response. I'm sorry, I thought this was the insulin one. There's a picture that looks similar to this in your book with insulin and glucose. Okay, so don't worry about this picture. Worry about what that I spoke to you about. All right, so let's finish up this slide. We'll do another 2-minute break. So if we become imbalanced, that's called homeostatic imbalance. Your book has several of these interspersed throughout the chapters. So basically a homeostatic imbalance would be a disease or disease process. Because as try as we may to keep things balanced, unfortunately, they become unbalanced and people get sick. Okay, so these will be listed throughout your book. We have to speak the same language, right? So we know exactly what's going on with patients. So the template that we use is anatomical position, which means in your mind, the patient is standing, feet on the floor, thumbs out, facing forward, right? And this is proper anatomical position. So that means the thumbs towards the outside are lateral. The pinky is medial. The arms are not crossing the midline, right? So no matter what position your patient's in, you always think of anatomical position. So anatomical right, would it be this hand or this hand?
It would be your right hand, right?
You're always referencing the patient's right. Okay, so anatomical right is the patient's right, anatomical left is the patient's left. Has anybody had surgery of your knees or elbows, right? What do? What does the surgeon do? They come in, they talk to you, remember? I was doped up when I had my back surgery. I was like, whatever, right? But he said, hi, Megan, hi, I'm Dr. Dischiavo. I'll be doing your surgery today. Don't take surgery from me. You are who? And you say, I'm blah, 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 right? Right? What are you here for today? I'm here for my right knee. And there's a nurse standing next to them, right? And the surgeon goes, which knee? Right knee. Nurse, right knee? What's in the chart? Right knee. Right. Why do they do that? So they mean anatomical right. Why do they do that?
Not to operate on the wrong.
Because people used to operate on the wrong side, right? I mean, hopefully it didn't happen a lot, but it's happened. And then what does the surgeon do? Pulls out a pen. Do they do this to you? Right? I don't mean to put you on the spot, but you're the only one, thank God, that has had, not that it was good for you to have surgery, but everybody else seems healthy, right? Pulls out a pen and signs it, right? So that way you're all in agreement, right? So we need to know that, so we know where we're going, right? Okay, so we'll go over this again. Excuse me, directional terminologies. All point and shoot stuff, okay? Stuff that makes sense, but we'll zip through it really quick. Superior means towards the head. This is also known as cephalad, okay? Or cranial. Oh my God, there's a spider. Cranial.
Oh, it's falling from the ceiling. I see it.
I know, it's creepy. It's creeping me out. Hold on. I'm glad this happened when I'm making the tape. There we go. Okay. At least it didn't land on me. The tape screaming. Okay. Woo! Got a little spike of adrenaline there. Okay. Why are these little bitty spiders and you're like, ooh! You know, you get your skirt and like run away, right? Why? Maybe because they can sneak. I found one in my bed the other day. I was like, oh. Anyway, all right, so refocus. Okay, so superior, not yummy. Inferior or caudal. Okay, caudad, caudal, towards the bottom. So my head is what to my stomach?
Superior.
Superior. My knee is what to my stomach? Inferior. Ventral, also known as anterior. Posterior, also known as dorsal. These are a little hard to see in your notes on the pictures, but don't forget you can open these PowerPoints on your computer. So, and I think it's good when you're studying to mix up how you study. So if you've been studying off your black and white notes for a week and you think you know it, open up the PowerPoints on your computer and it gives you a whole different way to look at it, all right? So anyway, ventral or anterior. Anterior, I think people use more as directional. Ventral and dorsal, I think they use it for compartments in the body, but they're interchangeable, okay? Dorsal I always remembered because what does a shark have on its back? Dorsal fin, right? So dorsal is to the back. Anterior and posterior I remembered because A becomes before P, anterior, posterior. See all these stupid little ways that I remembered stuff, but then it gives you double checks to remember stuff when you're looking at the test too, okay? Medial, which I think is off this screen, but it's medial towards the midline of the body. Lateral is towards the outside. Okay, medial, lateral. Intermediate, you can just cross it off, don't worry about it. Okay, so medial, lateral. Proximal and distal. People get confused about, so I'm going to take a moment here and explain proximal and distal. I will only use proximal and distal in reference to extremities. That's the only time I use it. I use superior and inferior on the torso. So just listen before you write. Proximal means towards the torso. My shoulder is proximal to my elbow. My knee is proximal to my ankle. Okay? Distal would be the opposite. Distal is further from the torso. My wrist is distal to my elbow. My toes are distal to my knee. Okay, so proximal and distal. That's all it means. People get very confused about it. Okay, does it make sense? Okay, proximal and distal. So proximal is towards the torso, distal is away from it. Okay. Superficial and deep is either towards the surface or deep. Easy peasy. You're like, yay, one thing that makes sense. Okay, so let's practice. You can like back in the notes if you want to. Pardon me. My sternum is blank to my shoulder. Remember, we're going to use proximal on extremities. But thank you for jumping in.
Medial.
Medial. Good. My nose is what to my umbilicus, which is my belly button. Superior. Fantastic. My knee is what to my hip. Distal. My elbow is what to my wrist. Proximal. Is that making sense? Okay, so just directional terminology on how to get around the body. Okay. Regional terms, wow, like lots. Okay, So I'm not gonna sit, and this is what I call point and shoot stuff. I'm not gonna sit and read them to you. We're gonna go over these in lab. We have kind of interactive labs, which are pretty fun, that we're gonna use for that. Okay, so there it is a general terminology. But I do wanna go over axial and appendicular, okay? So the axis of the earth is the center point with which the earth turns around, right? The axis of the body is the same, but to be specific, it's skull, vertebra, sacrum. So all your spinal column, we'll learn all these words in a little bit. Ribs, sternum. If you're talking about appendicular, what does it sound like?
Appendages.
Appendages. And your appendages are your arms and your legs, okay? But the appendicular skeleton also has what are called girdles. Your shoulder girdle and your pelvic girdle are parts of the appendicular skeleton. Does that make sense? And we'll look at that in lab. All right, so this collarbone and your shoulder blade are the shoulder girdle holding the arm on. And then you have what's called your bony pelvis that holds the legs on. Okay, does that make sense? Good. All right, so regional terms, like I said, we're gonna go over regional terms in lab. Here we go. Okay. All right, okay, so just listen for a minute before you take notes, and I'll go through these again, okay? Planes are imaginary lines that run through the body. And the reason we have to learn planes is because if we were to look at a radiological study, such as a CAT scan or an MRI, that CAT scan and MRI, I want to say cuts the body into planes. It doesn't really cut it, you understand, but it takes pictures in planes. So we need to understand, if your physician pops up a CAT scan of your patient, what plane you're looking at, okay? So if we're creating these imaginary lines through a patient, they will run in this direction, okay? And this will cut you into imaginary what? Right and left. Does that make sense? Can you imagine that? And why would it be necessary to understand these planes? What are you looking at when you're doing a CAT scan or an MRI?
Cross section or
Cross sections, but they're really looking for an organ and what's going wrong, right? So if you understand where these planes are, if I run a plane right here, which organ am I going through?
heart.
The heart, right? If I run it right down the middle, we could look inside the spine. Do you see what I'm saying? So if you have a grasp of these imaginary lines, you can see where you are on these radiological studies. Does that make sense? Yes, no? Okay. All right. Has anybody been to the bodies exhibit? Oh, well, the bodies exhibit is plastinated cadavers. They actually get bodies donated to them. They put plastic in them to preserve them, and it sounds gross, but they cut them into different segments so you could see inside. They have one body that's completely cut in these planes. Okay, so I think it gives you a good visual. So, sagittal plane is what I showed you. It cuts you into imaginary right and left. Is there one of these or is there multiple? Absolutely, right? As thin as you could cut it are as many planes as you can have. So, if we were to put, well, let's go right in order. This one's a little harder. I always think of this being like a crown, okay? This one would be frontal or coronal. This is going to cut me into what?
Back and front.
Yes, into front and back. Once again, is there one of these or multiple? multiple, right? Good. How about this way, transverse or horizontal? Cuts me into what?
Upper and lower.
Top and bottom. So we could look down and in. Is there one of these or multiple? Multiple. And if you look at a CAT scan, you'll have all these planes, right? If a patient presents with a problem, would we just try to do one plane? Exactly where the problem is? No, you want to see everything. If somebody comes in with back pain, it could be a herniated disc. It could also be a tumor. You want to see what's going on through the whole area to make sure everything's okay. All right? So, your book uses one or the other at this point, frontal, coronal, or transverse or horizontal. You can use either one, it's fine by me. Your book makes new additions by changing like 3 words in every new edition and changing things. So I'll accept either one. Oblique plane, I don't get much into, but oblique would be what? At an angle. So anything off those 3 planes that we spoke about, right? Okay. Does that sort of kind of make sense? Here's a picture of it. Okay, what plane, don't look at the answers because it is right there. What plane do you think might make this? Here's your lungs, here's your spine, here's your abdominal organs. Which one of those planes that we spoke about? Frontal or coronal? Good. How about this one?
Yeah.
Yeah, transverse or horizontal, very good. And we'll practice these in lab too. This one's a little hard to discern. This is your tailbone, here's your spine. I'd be facing this way.
Sagittal.
Sagittal, good. So you're getting the gist of it, right? Does it not make sense? Don't forget in lab, we'll go over it again too. How are we doing? I gotta watch the time. I just get so excited to teach. Okay, so body cavities. Just to give you the general body cavities. Okay, ventral means what again? Towards the front. Dorsal means towards the back. So your dorsal body cavity has brain and spinal cord. Okay, it says brain and central nervous system, but you could say spinal cord for simplicity. All right, has the cranium and the spinal cavity. Ventral body cavity is anything in the thorax and abdominal pelvic region. So if we think about thorax, what organs would be in there?
Heart.
Lungs and heart. Then we have the diaphragm. Under that, we're going to have a whole bunch, right? We're going to have stomach, liver, spleen, gallbladder, small intestine, large intestine, appendix, right? Reproductive organs in the pelvic basin. We'll get through all this. I just want you to know the general breakdown, okay? So does that make sense? So thoracic, ventral is going to be towards the front, dorsal is towards the back. Dorsal has brain and spinal cord. Ventral has what? Everything else, right? Everything else. And here's a picture. I'm a very visual learner, so it helps me to look at stuff like this. But once again, don't just glimpse at it and move on. Look at it and say, well, what's in there? If we look back, you have brain, spinal cord. What's in the thoracic cavity?
Heart and lungs.
Heart and lungs. What's in the abdominal cavity? All your GI organs. Everybody's saying different things, right? Because there's so many things. What's in the pelvis? Reproductive organs, bladder. You know what I mean? Take your time and really try to learn stuff. And then I'm telling you, I can't tell you how many times on an exam I'd sit down and be like, I have no idea what the answer is. And guess what I would think about? A picture like this. And then I'd be like, bam, got it, right? Take your time with these notes and material. The other thing I want to just mention as a little sidebar, every single one of my lecture exam questions comes from these notes that I give you. I guarantee you, I've had students argue with me, that was not in the notes. I teach this for 15 years. I'm like, here it is, right? Okay, so if you think that I'm putting things on the test that aren't in the notes, guess what that says to me as your instructor? you're not taking time with the notes, right? And I'm not faulting you. I'm not faulting you by any means. I'm just trying to get you to think about these things early and study early, okay? And there it is from the front, and that has the breakdown, okay? So pictures are helpful. If you were in a car accident, what body cavity is generally most susceptible to injury and why?
The head.
What surrounds the head? Skull. Right? What do you not have in the abdominal region? Skeleton. Just trying to get you to think about it that way. Is your head susceptible to injury? Absolutely. You know why? Because of your skull. Right? If you're in a whiplash car accident, you fling your head forward, your brain, guys, is basically ready to get grossed out. Does anybody get grossed out real easily? Okay, cool. Good. Gross stuff out. Okay? A thick pudding. It's not, when we look at the sheep's brains, when we do dissection, they've been preserved and desiccated a little bit. They're firm like a rubber eraser. Your brain is like a thick pudding. So you leave, God, I shouldn't say this. Suppose in the past you've had a car accident. I don't want to wish anybody ill, right? And you're driving, and you were driving, and you got rear-ended, right? Your head flings forward. Guess what that soft pudding of your brain does? Bam! Right into your skull. So this is a little bit of a tricky question. And then guess what happens? Your head goes backwards, bam! And you get contusions, anteriorly and posteriorly. So this is a little bit of a tricky question, but just trying to keep you thinking, right? All right, so abdominal pelvic, not encased in the bony protection that the upper regions have. Are you ready? This is a tough one. This is a put your thinking caps on one, right? Try to listen to me. Most of what you need to know is already in the notes. Can you? You already started. Thank you so much. You're good. You're hired. You're hired. All right. So this is one of those things. It's a little difficult to understand, but I will go over it again in the future. Okay, I'm just trying to give you the introductory basics. So just general introductions to the cavities of the body. In general, the cavities of the body are subdivided. Isn't that brilliant? If somebody comes up and stabs me in my abdomen and they introduce infectious agents into my abdomen, how far, well, it's horrendous in the abdomen, but how far will that infection spread? Just through my abdomen. Because then it's separated from the thoracic, from retroperitoneal. So we have these subdivisions in our pelvis, abdomen, and thorax to keep things contained, to prevent infectious spread. But we also have them separated and held in place by what are called serous membranes. And these serous membranes are basically one cell thick on a little surface embedded thing, right? And they cover the organs to help protect, hold them in place, and subdivide our body. Does that make sense? There's a serous membrane on the wall of the body. So if I were to cut open my abdomen and peel it back and touch the inside of my abdominal wall that's covered in serous membranes. If I cracked open my chest plate and I touched the inner wall, that's covered with serous membranes. The heart's a little tricky because it's actually a sac around it covered in serous membranes. Are you with me? There's also serous membranes on the organs. So while I have my chest plate cracked open, if I put my finger on my lungs, I'm touching a serous membrane. Are you with me? If I close that up, those serous membranes, what? Touch. They touch. We secrete a serous fluid that helps to decrease what in this region? Friction. Imagine if you had dry skin lining your lung wall and your lungs, okay? And we can actually have conditions that mimic that, and it's very uncomfortable. So they secrete a little bit of serous fluid that helps lubricate between those membranes because it's tight in there. All the organs are like, shoved in, right? And smushed together. So those serous membranes help to decrease that friction. They also help to hold them in place. If I were to cut open my abdomen and hold me upside down, my intestines wouldn't hang too far down, right? Because they're held in place with these serous membranes. Are you with me? What gets confusing are the names. I have to think about this every time I teach it. Every time, okay? So don't let it blow your mind, it all makes sense, okay? The serous membrane that's on the wall is parietal. That's it. And it's up here, parietal. So parietal serosa is a generalized term for any that's on the wall. Are you with me? Visceral is on the organ. Visceral, guys, refers to organ, period. If you're talking about somebody that has visceral pain, they have what? Organ pain. Okay? So the visceral serosa covers the organs. Between them is that serous fluid. Serous fluid is the fluid that's in closed chambers of the body. Around the lungs, around the heart, around the abdominal organs. As opposed to mucosal, which I know you know the answer to this. Mucosal is a membrane that's, I don't want to put you on the spot, open to the environment, right? Mouth, GI tract, right? Are you with me? Okay. So these are all serosal membranes. They're enclosed membranes. So pericardium is around the heart. That is the noun. Pericardial is the adjective. Just so you know. Okay? Okay, so pericardium. The pericardium, make note, is a sac around the heart. So it's a little different from the other ones we talk about. Plural is the lungs. Okay? So plural is the adjective, pleura is a noun. Don't drive yourself nuts. Just memorize these words, all right? So that's actually on the chest wall and the lung itself, as opposed to that sac around the heart. It's important to start learning the pericardium as a sac around the heart because that's going to have an effect on the heart. Okay, we'll get into that in cardiovascular. Peritoneum is around any not all abdominal organs, but many of the abdominal organs. We actually have some that are not in this peritoneum. Don't worry about it. Just know peritoneum is abdominal. Okay? And then you mix and max. So if I ask you about the visceral pleura, the visceral pleura is the serous membrane on the what?
Vessels, organelle.
Pleura. So visceral is on the organ. Pleura is around the lungs. So the serous membrane that is directly on the lungs is the visceral pleura. Are you with me? Just cross the L off because that's the noun. Okay, pleura is a noun, right? For this one. The other two are correct. Are you with me? Parietal is on the chest wall. Pleura, parietal pleura would be the serous membrane on the chest wall. Are you with me? I do this a couple of times to help you practice. Visceral pericardium is the serous membrane on the heart. Parietal pericardium is the serous membrane surrounding the heart. Are you with me? Let me give you another tip with studying. Sometimes things don't gel, right? If you have 5,000 things you have to study in the week and you have 100 you can't understand, try to give yourself tips to remember it. Visceral is always on the organ. Parietal is always on the wall. Write it down on your test. Well, actually, we do the test on a computer. Write it down on a piece of paper. Done. You know what that is. Pericardium, cardia, always refers to what? Heart. Right? Pleura is new, but we know that's lungs. Pleura is short, like four-lettered lung. See what I'm saying? Get your self-associations really early. Peritoneum is abdominal. It's the longest one. It also has most of the organs. right? Visceral peritoneum would be on an organ in the
Stomach.
abdomen or stomach. I would say abdomen because the stomach is a separate anatomical, right? Right? Is this starting to make like a little, it's hard, isn't it? Right? Okay, parietal peritoneum is going to be on the
Wall of the
wall, right? Okay, does it sort of make sense? This is one of those things that if it doesn't make sense, you memorize the words and you write it down before you take your test. And then you can piece it together. Tricky, yes. Effective, absolutely. Okay, all right? All right. So serous membranes, decrease friction, hold organs in place, surround organs in the ventral body cavities. Okay? Here's a picture of the heart. Like I told you, the heart, it's not on the wall of the torso, it's a sac around the heart. And basically it's a double membrane, just like as if you were to put your hand in a balloon. And the reason it's important to understand that is this balloon is not a balloon consistency, it's like a glad bag. It's very tough. So if we get fluid around the heart, guys, does your heart beat as effectively? Absolutely not. So it's just a good clinical thing to start learning that, okay? So the pericardium, some people will call this a pericardial sac, okay? And just a little different from the other parietal and visceral presentations. Should we practice this or do you feel like you got it?
Good practice.
Practice a little bit? Why not? Okay, parietal pericardium,
It's the wall of the heart.
wall of the heart, right? Don't forget it's a sac. Visceral peritoneum,
It's the organ on the stomach. Or the
an organ in the abdominal region, that's okay. Parietal pleura, on the, actually on the wall of the lung cavity, right? Good. Visceral pericardium,
That's the organ.
on the organ of the cardiac heart, right? Right? Making a little bit of sense? Once again, if it doesn't, it's one of those things, I call it a brain dump, right? You memorize it, you go in, you dump it. If you're not sure of it, give yourself ways to remember it, and then once you see it, you can piece the words together to the questions, right? All right. So, abdominal pelvic regions and quadrants. Okay. I used to just do quadrants, but from what I understand in nursing, you will need to know regions, which are more. Quadrants are obviously 4, and regions we have 3, 6, 9. So we're going to go over both, so you know, all right? So some helpful definitions. We're going to look at all of these. Let's just look at them by definition first. And these are those 9 regions. There's 2 of each, okay? So hypochondriac. If you know what, let me just give you a visual first. Okay, so with quadrants, we cut the stomach into 4. And that's simple. Right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. It's good to get a working knowledge of where all the organs are, because quite often people will say a patient presents with right lower quadrant pain. So you need to know what organs are there and or refer pain to that area so you can help to do what with that patient? Diagnose them, right? So quadrants help to lead us to specific structures that might be damaged or hurt in a patient. I believe in nursing they break it down to regions. So you can see there's 1, 2, 3, just about the level of the stomach, just below the ribs. 3 right in the middle where the umbilicus is, or the belly button. And then 3 in the pelvic region. Okay, so we're gonna name these. So let's go back. Oh, we go over this in lab. Hold on a second. Oh no, we're good. We have time. Okay, so, yeah, we have time. Perfect. So the ones in the middle are going to be umbilical, Let's go at it that way. Okay, and there's one umbilical right in the center. Epigastric, epi means what? Does anybody know what epi means as a prefix? Above. Does anybody know what gastric means? Stomach, epigastric. So we have umbilical, epigastric, and then we have hypogastric, which will be below. Okay? Right? So those are the three midline ones. Hypochondriac is below the cartilage. This is cartilage here in the ribs. There's a right and a left hypochondriac. There's a picture of this in your book too. Okay? This region is lumbar region, or low back. I always remembered it, L and L. You have right lumbar, left lumbar. Iliac is the superior part of the hip bone. Right iliac, left iliac. Okay? Does that make sense? And then I believe it's on the picture in your book, but you can also fill it in on this chart here. It's a good idea to start getting a working knowledge of sidedness of organs. Okay? Liver, spleen, the wrong side. Liver, spleen, gallbladder, appendix, where the intestines are in general. The intestines are kind of everywhere in the stomach. Okay, so get a general working knowledge of organs and where they are in these quadrants and regions. Okay? Does that make sense? Do you have any questions about that? All right. So, if a patient presents with pain in the upper right quadrant, what organ could be affected?
Liver.
Liver, right? Gallbladder, maybe some of the intestines, duodenum, pancreas, etc. Right? In the lower right quadrant, what organ could be affected? Appendix. That's a big one to know for that right iliac or right lower quadrant. In the left hypochondriac region, what organ could be affected? This might be a little tough. Spleen, very good. Okay, spleen could be part of the intestines, all right, as well. Good, you get the general gist of that. We'll go over that in lab as well. All right, other cavities, pretty self-explanatory, correct? Synovial might be the only one that you don't know. Does anybody know what a synovial cavity is? It's a cavity where we have somebody was starting to say it, synovial joint. Okay, synovial joint you're not supposed to, but they're joints that you can pop. They're ones that have little openings or little cavities, I should say, that are full of synovial fluid that help to lubricate and move our joints. All right?
It's all over the body or just
Anywhere you have a movable
Like
joint like that,
okay.
yeah? Yeah. I mean, there's some slightly movable joints that are not synovial, but most of them are. We'll get into that in bones. All right, any other questions? Welcome to your first lecture.